So, I want to be clear how we're defining age in this conversation, right? Age can mean a lot of things. It doesn't have to define us, it doesn't have to mean that things are getting worse. But when we're looking at an animal that is slowing down, a dog that is slowing down, and we say he's just getting old, what we're actually saying is he's starting to decline. His body is starting to decay, which is also a normal part of the aging process, right? So we start to feel like declining is normal. And I want to separate those two because while it is normal to decline, and it is normal to die. I know we don't talk about that in our society, but it is a normal part of being human or being a dog, is that our body is going to fail in one way or another, and we are going to die. So when we're referring to that failing process and we call it aging, while it is normal, that doesn't mean it doesn't come with side effects or pain, and it's our job as dog owners, as pet parents, to make sure our pet is comfortable. It's actually our responsibility to make sure our pet is not suffering, right? Because what we don't realize is we confine them in a safe environment in our home, but if we don't give them access to good medical treatment or allow them to pass peacefully, we kind of keep them alive longer in this declining phase, which could mean prolonged suffering. So again, we'll keep coming back to it. So how do you know? How do you know? Okay, so there's a few things you can look at. One of the first things I like to look at is how well is your dog sleeping? If you have an elderly dog who's sleeping most of the day, I think that's a great thing. It's amazing how many clients tell me that's a sign they're not doing well. While it is a sign that things are declining, it's also a sign that they are comfortably handling that, okay? And I'm not talking about just laying down because it's really difficult to get up. I'm certainly not talking about sitting and panting and trying to recover. I'm talking about being in a deep sleep for a lot of the day and all of the night is a good sign that your pet is aging and able to stay comfortable. So if your pet is restless at night or anxious at night, honestly, if your pet is restless at any time, that is concerning. Restlessness can be a sign of anxiety, can be a sign of dementia, especially at night. It's very common, just like in humans, for dogs to get really anxious at night if they have dementia. But restlessness is also a strong indicator for pain. And so it can be confusing which one is it, but we do know your pet is not doing well, right? So we know if your pet is restless, anxious, and not sleeping, we already know they're not doing well. Now we have to investigate to find out why and whether pain is involved. And this can be tricky because anxiety and pain can look the same in a dog because they both elevate the respiratory rate. The respiratory rate is how many times you see your pet take a breath within a minute. So it's best to start learning what's normal for your pet now. After your pet goes on a walk, and then maybe an hour or two later when they're completely recovered and rested, count those respirations. Count the number of times their chest or their belly moves up and down within a minute and get an accurate count, an accurate normal for them. Now, when that starts to change, that can be our number one indicator that your pet is in pain. Now, a dog who's anxious isn't going to be laying down and having that rapid breathing. So that can be a distinguishing factor. A dog who's anxious is usually going to at least be sitting up, if not pacing around. Now, a dog pacing around panting could easily be anxiety or pain. And if you have a pet in that condition, I would get them immediately to a veterinarian for evaluation, to be honest. So changes in respiration can look like really shallow breaths. That means the chest is barely moving up and down, but it's doing it very fast. It can be very labored breathing. That's where you really notice that rib cage having to work really hard for each breath. Those are changes in respiration that indicate that your pet is not doing well. And that could be because of pain, it could be because of disease. And any changes in breathing should be taken very seriously.